the difference between, for example, a day in the life of a support worker in an organisation where they're using a good practice framework, for example, active support, will include a lot more activity based around the individuals that they support. And they will be doing, in general, the things that the individual wants as much as they possibly can, led by the individual, and in as many ways as they can during the course of the day. They will usually be thinking about the rest of the day ahead, thinking about opportunities. They'll generally be quite good, hopefully, at planning ahead and seeing opportunities, even if they're not written on a piece of paper in terms of a plan. In contrast, in services where that isn't true, staff, they tend to be less satisfied in general than in services where they've got a good kind of practice framework. And they also, we tend to, when we talk to staff, they're more bored in one setting than the other, and they spend the whole of their time doing cooking and cleaning and the tasks that are kind of about looking after the house and looking after people, rather than enabling and empowering people. So what they do and how they do it during the day looks really different. And actually the atmosphere when you walk into a service or a setting where staff are working in those two different ways feels quite different. But we do know from some of the research that when you move staff from one model to the other, initially there's quite a lot of resistance and dissatisfaction because most people don't like change. But if you give people enough time and support, they move, and it's often very hard for people then to think about what they used to do. So we talk to staff and they say, well, what do you mean? Well, how is it different than it was before? Why would we have worked any differently? Isn't this the right way to work? And so their attitudes change. And we generally find that retention of staff improves, so people are less likely to leave the organ, or at least to express their desire to leave, than in services where these kind of approaches are not being used. And generally, as I say, satisfaction over time improves because they actually are getting so much more in terms of the relationship with the individual they're supporting, and have quite different kind of attitudes to the people. And I say once they've moved, actually it's really hard for them to think about any different way of doing it. In terms of the cost, it actually doesn't cost any more to provide good support than it does to provide particularly poor support. We've just done a research study that I'm in the middle of writing up that showed we were able to collect really detailed cost information working with our economics partners in the University of Kent, and we were able to show that actually the cost of the care packages for people receiving good active support, which usually also involved good communication support, much better support for challenging behaviour and more autism-friendly approaches to individuals, that didn't cost any more money and didn't require any more staff than services where that support wasn't there, where it was much poorer, or sort of mixed to poor, inconsistent kind of support. So it wasn't that everybody was getting really poor support, but on average people were getting really rather mediocre support. But where we looked at the differences between them getting good support consistently and not getting that consistently good support, there was actually no difference in terms of cost and the amount of staffing. What we did find, which was really interesting, was that staff are used much more efficiently in services where active support was the dominant model. So we had information about the amount of hours that people were supposed to have in terms of their funding, so the number of contact hours. And then we had observational measures of how much time they actually received contact from staff. Okay, so we had those two measures. And we did a very simple analysis where we subtracted the amount of time that people were getting support from the amount of time they were supposed to get support according to their funding package. And we found that in the good services, the discrepancy was only 4 minutes in every hour. So there were only 4 minutes less that they were doing things that didn't involve the person. compared to what they were funded. And the discrepancy in services where they weren't using the active support model was 25 minutes in every hour. So almost half of the funded time was not being spent in contact with the individuals, which obviously explains the poorer outcomes for that group of people, because actually the staff aren't there. And we did find that, obviously the amount of time people give assistance and the quality of life of individuals is much better. And so there's a whole efficiency model, kind of if you use good support. And it's a real pointer for our system is funding a lot of not very good services, whether they're residential homes or whether they're supported living environments. And that's a lesson for our system from the research. I think the implications for the NDIS and the design of the system are particularly around the need to think about the support and the training that is given to people who may be supporting individuals in the community. And that doesn't necessarily mean high-level qualifications, but that people, as they are employed to support the individuals, as they're recruited by individuals to using their personal budget, that there is a system that helps to give people those skills that they need. That also involves the individual they're going to support. So it's tailored to that individual, but also has some of the general principles that we know are important to skill people up, to give them the skills to be able to do this. And there is a huge relationship here between supported decision making and the practice model, in that if you think about all the opportunities of every moment of the day, to skill up people's ability to make decisions, to make choices. Many people have had very limited opportunities in their past to make those decisions, especially older people and people who may well have been in more institutional services. Their opportunities to make decisions and to have those respected have often been really limited. And it's really important that that day-to-day support provides many opportunities for making decisions, for learning that people will listen to you when you make decisions, and that you can have control over your life, even if it's something as simple as how you want to make your bed, what colour of pillowcase to put on with what sheet, through to where do you live, where would you like to live. And that can't be done with people with severe and profound disabilities. That has to be done quite thoughtfully. It has to be done through experience. People need to visit places that they may live, and they need to meet people that they might be going to live with in order to make those decisions. And that has to be done through kind of an experiential process. And if people are really going to have choices in the bigger decisions in life, they have to have a support system that shapes them up and everyday opportunities to make decisions. And they need to have people who know them well through working with them on a day-to-day basis in a way that is empowering and enabling. It's very hard to find out what people like or dislike, what their preferences are, even how they communicate if all they do is sit and stare at the wall, or do self-stimulatory behaviour, or even just watch TV and listen to music all the time. If actually they're not out there in the community trying new things, or even in their own home trying new things, it's really hard to work out what do they like and dislike. And for people with severe and profound disabilities who are generally not going to communicate verbally to us, you have to look, you have to watch, you have to see people's responses in this situation versus this situation. Do they seem happier here than here? And so you don't get to be able to do that without experience of working with the individual. However, if you've got some of the knowledge and the principles, you can very quickly move forward. You don't have to have known somebody necessarily for a year before you can start to help them to make decisions. Actually, you start at the process and you learn together. And every time a member of staff is enabling somebody to make a decision or to try something new, they themselves are learning something about that individual. And I think it's really important tying those two together, that in order to have supported decision making and to really help people to be as involved as possible in every aspect of their lives, that has to be something they learn to do, and they learn that it's worth doing because people listen to them. And that's not the experience of many people with intellectual disabilities currently. And most important, I think, for the people with lower levels of communication skills, where they don't communicate in the traditional way and can't sit in a meeting and say, well, what I really want to do is this. You have to learn by experience with individuals.